Welcome to my YouTube channel. Thanks very much for the subscriptions. For those ones who subscribe, those ones who have not yet subscribed, please do one thing: subscribe, put on notification, and we continue to learn, we continue to live a disease-free life. We continue to evaluate and know the root cause of the common infections that bring discomfort to our life, that bring complication to our lives. Today I'm here for our episode 2 on pelvic inflammatory disease, and basically today we are going to look at a condition which we call salpingo Oophoritis, or possibly Oophoritis. What is this condition? Is an inflammation of the ovaries. Oophoritis only is an inflammation of the ovaries, which is due to ascending infectious pathogens from the cervix, the uterus, the fallopian tubes, and to the ovaries. And this is the root cause of infectious morbidity, sterility, and increased ectopic pregnancies in women. Salpingo involves inflammation of the fallopian tube. But Oophoritis, when we have our genitourinary system, here we are having our cervix. So what happens is, when you get an infection, it can be a chlamydia infection, chlamydia trachomatis infection, or a gonorrhea infection, or any other bacterial infection. It can be bacterial vaginosis. And these pathogens, the bacteria, they colonize the cervix. So when they colonize the cervix, what happens next? From the cervix, they are going to move, they are going to migrate. So they are going to migrate from the cervix to the uterus. So from the cervix, they are going to come here in the uterus. Then from the uterus, they are going to continue the fallopian tubes. So here they are going to be here in my tubes, the bacteria. So they colonize from the vaginal opening, they colonize the cervix. From the cervix, they enter the uterus. From there, they are going to continue to the fallopian tubes. Then from the fallopian tubes, they are going to come to what? To our ovaries, and infect our ovaries. So when the ovaries are infected, what is going to happen? You're going to have inflammation of the ovaries, this inflammation is going to take part of the fallopian tube and part of the ovary. Hence the name salpingo Oophoritis. Salpingitis is inflammation of the fallopian tube only. Oophoritis is inflammation of the ovaries. So when these two are inflamed, in some cases they are going to develop a mass, which we call a tubo-ovarian abscess. They are going to form a mass of adnexia, which contains pus and other dead bacteria and whatever. So which we call a tubo-ovarian abscess, as you are going to see it in the subsequent videos. So what is happening? We are having the ovary is inflamed. What are signs and symptoms of Oophoritis? What are the signs and symptoms? How do I know that I have Oophoritis? When do I know that I'm having Oophoritis? When do I need to worry that I'm having Oophoritis? First of all, you're going to experience what we call lower abdominal pain, just below your umbilicus. So these signs are This Oophoritis normally is asymptomatic, and the signs develop mildly. They range from mild to severe signs and symptoms. So the first one is going to be lower abdominal pain. The second one, you're going to be experiencing heavy menses, heavy menstrual periods than the usual ones. You're going to have painful urination and burning sensation. Pain during sex and probably bleeding after sex. You're going to have a vaginal discharge which is heavy and having a foul smell. So those are some of the signs and symptoms of Oophoritis. When it goes undiagnosed, it can develop fever, it can develop chills, it can develop vomiting. If it goes undiagnosed, and the fever, the temperature can go up to 38 degrees centigrade. So those are possible signs and symptoms of Oophoritis. What are the tests that we do? What are the complications? The first test we do is a total or a complete blood count. In this, what are we looking at? We are looking at white blood cells. In Oophoritis, the number of white blood cells is increased. Secondly, we are going to be looking for clotting factors and inflammatory factors. Then we are going to do a urinalysis test, a urine test to rule out cystitis. We are going to do a pelvic ultrasound scan. We are going to do a laparoscopic surgery. So we are going to see in details what do we expect to see when we do a scan, when we do a laparoscopic surgery. Then from there, we are going to look at how do we manage the complications. For immunocompromised Oophoritis, normally we do what we call a hormonal supportive therapy or a hormonal replacement therapy. Secondly, this inflammation can lead to blockage of tubes. We are going to see tubal blockage as a topic in the subsequent videos. So when it happens, the chance for producing goes to in vitro fertilization. We are going to see what are the risk factors. The risk factors of Oophoritis, we are having multiple sexual partners. A lady having multiple sexual partners, it is exposing you to higher chances of having Oophoritis. Secondly is unprotected sexual intercourse. Then we have high risk sexual workers. We have high risk of developing Oophoritis. We have immunosuppression. Then we have previous history of instrumentation of the genital tract, such as IUD implants. We have evacuation procedures. We have biopsy. What are the differential diagnoses? The differentials which we have to rule out, which might have the same symptoms as Oophoritis, but we need to rule them out. So, first of all, we have adnexal tumors, we have adnexal torsion, we have diverticulitis, we have ectopic pregnancy, gastroenteritis, viral gastroenteritis, bacterial, we have non-bacterial cystitis. Then we have what we call mesenteric lymphadenitis. So these are some of the differential diagnoses we have to rule out. You have to confirm it's not one of them, plus appendicitis, because they might have the same symptoms as Oophoritis. So we are going to see in details how do we diagnose Oophoritis. On ultrasound scan, what do we expect to see? When doing laparoscopic surgery, what do you expect to see? Then on top of that, we are going to see management. How do we treat it, both surgically and medically? What are the drugs we use to treat Oophoritis? So we are going to see all these in details in our subsequent videos. Just keep in touch. Thanks very much for watching. Don't forget to subscribe and put on a notification.